All right, so before I place my epidural, I'm going to do a thorough chart review, checking for allergies, make sure there's no allergy to local. I'm also going to check coags, make sure the patient hasn't recently been anticoagulated, and then also any type of abnormality of the spine, such as scoliosis. I'm gonna go into the room, make sure my patient is properly positioned. I'm gonna make sure that I have a pulse ox as well as a blood pressure cuff hooked up, and then also going to make sure I have fluids open for adequate preload. Once I get the patient positioned, I'm going to palpate at the Tuffy Salon, just showing me L3, 4. I'm gonna come across. I'm also gonna feel the anatomy of the spine, feeling in between each vertebrae. So once I find my spot, I'm gonna mark that either with a needle tip or my finger to have a good place. I'll now don my head cover, mask, and sterile gloves. Before donning my sterile gloves, I'll make sure that my my epidural kit is all open and ready. Okay, now that I have my sterile gloves on, I'm going to start getting this set up. So I will open up my prep, trash, and sterile prep. So I'm gonna go back and forth. And then we can dry with sterile gauze and wait 3 minutes for the sterile prep to set up. While that's being set up, we can put our drape. Now that we're draped, we can go ahead and draw up our drugs. So using a filter needle, we'll draw up lidocaine for skin local. We'll have 3 cc's of lidocaine with epi for our test dose. And then with assistance, we will draw up our bolus dose of 0.25% bupivacaine. Now that our drugs are filled up, we will take our skin local with lidocaine. We're gonna go at the point that we marked. We're gonna go in at an upward angle at 15 degrees, place a skin wheel, and then we're gonna use this as a tester needle to go straight in. And the goal is to go straight in, not hit any bone. Once we're in, we can inject lidocaine and come out. Now that we're numbed up, we can take our epidural needle and we'll go bevel up. We're going to insert through the skin, through the sub-Q tissue. Through the sub-Q tissue into the interspinous ligament. Once we're here, our needle should be stabilized. We can remove the stylet and we will grab our loss of resistance syringe with 3 cc's of air or saline. Attach to our needle, and we will slowly advance our needle. We're gonna feel what should be described as crunchy as we go through the ligament and flavum, and as we get into the epidural space, we will feel loss of resistance. Once we feel loss of resistance, we can aspirate, see if we have CSF return. We don't. Now we will insert our epidural catheter. So holding firmly on our needle, we're gonna advance the epidural catheter. So right now my needle is at about 4 centimeters. So we wanna go about 4 to 5 centimeters past our needle. So I'm going for 8 to 9 centimeters. Okay. Once we get to the correct depth, we'll pull out the needle while keeping our catheter in place. All right. We'll now connect this connector onto the end of our epidural catheter. And then I will get my testo syringe, connect and pull back, checking for blood or CSF. If I'm negative aspirate, I will inject 3 cc's of the lidocaine epi mixture. And wait about 3 minutes to ensure that we are not intrathecal or intravascular. If we were intrathecal, the lidocaine would cause a sudden loss of sensation. And then if we were intravascular, the lidocaine could cause tinnitus. It could also, the epi would also cause increase in heart rate and or blood pressure. So at 3 minutes, test dose is negative. So we can now get our bolus dose of BUPIV. Again, we're gonna connect using our filter. We will again aspirate, negative for CSF and blood. We will now administer about 20 mils of 0.25% bupivacaine and 5 mil intervals. We will now secure our epidural with a sterile tegaderm. And then we can connect our epidural catheter to a PCA pump to continue administering pain medication. Once we're all done, we want to obviously assess the vital signs to make sure we haven't had any dramatic drop in blood pressure, and continue from there.